Hey Professor, my name is Justin Kwabuing, and today I'm going to be displaying for you moving a patient into the right lateral position and putting on correct donning and doffing of the PPE equipment, and this using proper right precautions and just getting consent and whatnot according to this patient. So this patient right now is semi-conscious, and he is unable to really move and unable to really communicate. So I'm gonna go based off of that and do this video based off of that. So let's get right into it. So first off, we're gonna get into correct donning. So let me get. All right. So first, of course, I'll wash my hands. Good. Makeshift paper towel, perfect. All right. So and oh yeah, these are my scrubs. Black shirt, track pants. Yeah. All right. So first off, we're gonna start with the gown. All right. So with this gown, slip it on just like this. And when you're tying the strings, make sure these strings are tied in the back so that they're not hanging in the front and get dirty because we want to use them, you know. So we tie it up here and tie it back here. Make sure that it's perfectly on. Yeah. All right. Perfectly on, done. And then next we would put on the mask. Good. Perfect. Then you put on the protective eyewear. And then you get the gloves. Perfect. Alright, so this is how you successfully don. Alright, so I'm successfully set up the don. Alright, so since this patient is unconscious, I'm still gonna try to get my consent from him, communicate him in a correct way, and try to position him as safe as possible. Okay, so first of all, I'm gonna knock, introduce myself, privacy, whatnot. Knock. Hey, Mr. Martin. My name is Justin Kwabuing, and I'm your nurse today. I know that you're a little semi-conscious, but I'm still gonna ask you for my consent, still communicate to you what I'm doing to you, make sure that you're okay with it. Okay, perfect. And don't be alarmed by all of this protective gear. It's all for your safety and my safety, so that no germs or anything gets on you, that you're completely safe from all infection or anything. All right, perfect. So let me give you a little bit of privacy. I'll close the curtain, makeshift curtain, and as you can see, the patient is currently in a semi-Fowler's position. So we're gonna have to get him out of the semi-Fowler position by lowering the bed. Alright. So I'll makeshift lower the bed, crank the bed down, crank the bed down. I'll get him to slowly reduce his height. Good. Perfect. So now the patient is right in the center of the bed. Mr. Martin's right in the center of the bed, and we're gonna be performing the right lateral positioning for him. So, hello, Mr. Martin. So, I'm first going to move you a little bit to your left side, and then use some pillows to prop you up and put you inside the right position, because you've been in that position for too long. It's been about 2 hours. You've been in that position. We're gonna try to switch it up for you so that you don't get any pain or anything. Okay. So perfect. So I come over here on this side. Good. And then I cross his arms. Good. And I put this leg up right here. And then I use this little bed sheet and whatnot. And I say, okay, Here, Mr. Martin, on 3. 1, 2, 3. And I lower the bed so that it's right on my height. Lower the railing so that he's able to move. And I move him like 1, 2, 3. Good. Perfect. Now he's all the way to the left side of the bed so that he does not fall off the right side when we prop him up into the right lateral position. Okay, so we'll get him like this. Undo him. Good. Perfect. Alright. This procedure is gonna be using 4 pillows in total. This pillow being 1, and then 3 more back here. So first, we're gonna take that pillow and prop up his back. So Martin, we're gonna start to roll you onto your right side. Roll him. We move his arm like this, put his leg like this. Roll him. Good. And we prop him up onto his right side. Perfect. Prop him up on his right side. And then we get this pillow right here, and we put it in between his leg. Right in between the leg. So the leg is propped up as well. Perfect. And we get this pillow right here, and we put it in between the arm. So this reduces all pressure from the backside, that no ulcers will be created. Okay, so now he's in the correct right lateral position. He's in the correct right lateral position. We make sure that Mr. Martin's okay. Sir, how are you feeling? Is this a comfortable position for you? He said, okay. And then we make sure that everything's covered up. Nothing's showing. He's perfect. He's safe. He's resting. And then we proceed to close the curtains, and then we start to enter the doffing method. Alright, so first for the doffing method, you look at your hands, you see if there's any germs or dirt on your hand. Look, okay, nothing. You wipe them off, good. And then you ball your hand up into a fist, you remove the glove, good. Ball it up again, remove the glove. Oh, okay. Now you wash your hands. Proceed into washing your hands. Washing. Okay. Now next will be the gown. You untie the gown, and you let it fall down. Yeah, you let it fall down like this. And then you just roll it up into a ball, and then dispose of it. Good. And then next, it is going to be the protective eyewear. Take it off from the back. This. Oh, wait. So yeah, you take off the gown, you wash your hands again, wash your hands again, wash. Then you take off the goggles from the back. Perfect. And then wash your hands again, wash. And you take off the mask. Okay, perfect. Yeah, so now we have successfully doffed. Mr. Martin is in a perfect right lateral position, and yes, now we can move on. But thank you so much, Professor, for looking at this video, and this is how you correctly put Mr. Martin into the right lateral position.